One of the things that has come out of measurement-based care and Yale measurement-based care collaborative's process is the idea that it's a simple activity to look at data and start to think about or create some hypotheses around what that may mean. And that said, a little practice can probably go a long way to just helping people feel comfortable with it and seeing how others would respond as well. And the idea that it doesn't have to be a concrete, absolute answer, and that the exploration is a big part of the overall process and activity.
We like this exercise because for folks who aren't used to doing this, what we're essentially saying is we're going to kind of take stock of these measures really quickly with the client often in the room with us so that we can get a feel for what they're telling us. So what we have in front of us is a PHQ-9. We're going to see all of these PHQ-9s have moderate depression, but the patterns are going to be where it's at. I'm seeing from Dan, this person feels acute impact on their life from their symptoms. So you're really homing in on item 10. And I think that's fantastic because there are patterns of symptoms. And this measure, which is kind of unique to this measure, asks about how distressed people are. And that's actually really important data to understand how much they're troubled, how much their functioning is impacted, as well as the distress. Jennifer thinks this is excellent for goal focus. Part of why we like the individual items is because it does help us pinpoint a little bit what might be some topics to explore more. Items 1 and 2, which are, for those of us that work with a lot of depression, we know this is where it's at with depression. These are the 2 primary symptoms, and that's definitely a discrepancy. When we see those, it's definitely something to get curious on. I'm seeing people are pointing out some things. So this is really fantastic. So I think we've heard great ideas about this one. Shall we move on and look at the second example? It might not look like the screen changed much because this PHQ-9, I'm kind of giving away a little bit here, is almost identical to the last, but there is one big change in particular. Are you having any different ideas or hypotheses? Andriana says, number 9. Absolutely, that's the big difference. And yes, item 10. So these scores are both reflective of the same level of depression, but once we look at the items, we get more insight. Sometimes we're using the measures to develop that shared language, which is one of the strengths of measurement-based care, that it allows us to do that it gives clients other ways to help us understand what their experiences are and to communicate with us in a different way, and for us to generate that shared language around what these terms mean.
The ways in which people are looking at the language and understanding it, that gives us some additional insights as to their experience. I remember talking with a teenager who was experiencing significant amounts of depression as we all would think about it clinically. But then when the person was filling out the form and it was asking them if they felt depressed, or sad, they were like not marking those items. And so we're surprised that their scores were so low. And so we started to get curious about that together. And the person said, I didn't say I was feeling depressed. I told you I was feeling a type of way. And so then we started to try to get some language, right, around what does this mean to you and how might that help other people understand what you're talking about when you're describing your experience. So some psychoeducation was definitely able to happen there.
As the person has moved on, they're describing things that would likely be linked to anxiety or depression, but are answering no to the questions above. And could there be a lack of understanding around the definition of it? And I think that's just another great example of the way the discussion with a client how this can help inform the discussion with the client and create a better alliance and understanding of what you're accomplishing in care.
Sometimes we're actually seeing discrepancy in what we're observing and what the client's telling us with what we're seeing on the form too. So that's another place where things sometimes don't line up. And that creates another opportunity for that exploration. There's never just one reason. And I think that's the key point. That's why we want to take time for that collaboration and that curiosity. So in this one, we're actually seeing something that sounds a lot more like depression, what we would be expecting to see. But one of the things that I do want to highlight is that, let's say this person's referred for depression and we look at the PHQ-9 and it looks like depression. We want to also make sure we're still pausing and doing the same process, even when the measure kind of maps onto what we would expect to see, because there could still be things that we're missing. There could still be places for education that we might want to make sure that we are pausing for. There are excellent clinicians on this webinar, obviously, who have a lot of ideas about what this might mean, a lot of hypotheses about the clinical picture. So you've got excellent training. And now it's about utilizing what we're seeing in front of us for that collaborative conversation with the client so that we have a shared understanding together. This is the place where we can make sure we're really aligned on our clinical understanding so that we're in the best position possible. I personally find it's so much easier to align and to stay aligned when we have a tool like this in front of us to draw from.
Ultimately, as so many of the comments have made, it's about what the client or the person that we're doing this with and the feedback we get. And these are questions we have, but they're not the answers. And that it's the truth that the person brings into the room and the shared language that we develop together as part of this process that makes it so meaningful.
It is very much a thing that you need to look at and need to try to understand. And then there are pieces that will stand out that allow you to be curious in session and have a discussion with clients and build therapeutic alliance and build understanding around what you're trying to accomplish in care.